people think that if you're going to a fertility specialist, that means we are going to do only IVF. So that we can overcome specific reproductive challenges and ensure that they get pregnant quickly. Our old-fashioned ways,
exactly.
not
the
to
traditional way and
yes,
everything.
to get married early and have children and then maybe go for your career.
So, hi everyone, we have with us Dr. Tejashri Singh from Fertility X. Let's have a talk. First of all, ma'am, welcome to the show.
Thank you.
So, I want to ask first of all something about yourself plus the brand you are running this.
Yes. So, hi, I'm Dr. Tejashri Singh. I'm actually a specialist in fertility and reproductive medicine and the founder of Fertility X, which is Advanced Fertility Solutions. So, what I do is that I integrate the time-tested, like science-backed clinical strategies with the latest innovations in fertility treatment to create that scientific, individualized plan for the patients so that we can overcome specific reproductive challenges and ensure that they get pregnant quickly.
Okay, and how old is this brand and what inspired you basically to start this brand?
Yeah, now this is a very good question because I'm a practicing doctor since 25 years and my brand is just 1 year old. So actually, this is something what I feel is that the digital and social media presence is there since a long time. But I was introduced a little bit late to it, and I would say that is a mistake. But I converted it into a lesson. And since 1 year, I'm constantly promoting. So I'm trying to cover up for the missed 7, 8 years. Okay. So I feel that there's a big gap in fertility care and the role of a fertility specialist. Like, for example, people think that if you're going to a fertility specialist, that means we are going to do only IVF. We will not do natural pregnancy. Also, there is a lot of misinformation in social media saying that being healthy is being fertile. What I mean by that is that, like for example, say you have a couple and they're not having a baby, then all the people around them will tell them, do yoga, do this, do natural lifestyle modifications, and you will get pregnant. So it's high time we understand that infertility is a disease like blood pressure and diabetes. Like if your blood pressure is high, if your diabetes is there, 400 sugar, you will not do yoga to make it normal. Similarly, in fertility, there are, causes. Once we take the cause and correct the cause, it is very easy to get the patient pregnant within the first 3 months of trying. And I get patients daily in my practice who are trying for years, like 6 years, 7 years, to get pregnant and doing nothing at all, just trying to be healthy. So I have to tell them that, okay, stop. You are in a race to become that perfect Miss India or something like that. But that's not going to make you pregnant because infertility is not your fault. That is the first thing we are telling the patients. So,
Yeah, all right. So, what are the biggest challenges you faced in the early days of your business?
yeah. So the biggest challenges with this only that, like patients are still scared to come to fertility specialists.
Yeah, I can understand.
There is a lot of stigma about talking about infertility. Patients don't want to admit that they are suffering. So I think this was the biggest challenge to break through. So what I do for this is, as soon as a patient comes to my clinic or I am taking a video consultation on my channel, I will take a detailed history and I try to enter into the psyche of the couple.
Okay.
And I feel that once I enter into the psyche of the couple, I'm able to understand and build a good rapport with them. And I also nurture open communications. I am like, I want to make the patient participate. I do like thorough counseling and then we make like informed decisions. And once the patient starts participating, they become very friendly. They understand my, protocols. And then I feel that they decide to go ahead with me. So I think
so
that's
how do you differentiate your brand in this competitive market? In market, there's so many competition, even in West also in fertility and like your business. So how do you differentiate your brand with all the others brand which is in the industry right now?
Right. So I would say that the good part of my brand is the innovation part. So I approach IVF or any other infertility treatment with latest fertility innovation. See, still, I mean, if you see in the US, in the UK, everywhere, even in Europe, people are still doing the old-fashioned IVF. Old-fashioned IVF means that they will be just, like treating the woman like a guinea pig. It's like they will make the embryos, put it inside the woman, and they say, "Oh, your uterus will select." And you may fall pregnant, you may not fall pregnant. And many times, patients fall pregnant and they have miscarriages, you know. Plus, people are still putting multiple embryos. I get patients coming from, Indian villages where doctors are putting four embryos. And that's because they are not doing the high quality IVF. So my advanced fertility solutions include two things. First thing is, of course, to understand the specific problem of the couple, because many people, the problem lies with the man and they are treating the woman, or the problem lies in the uterus and they are treating something else. So the first step is to make a diagnosis. So that is the thing which I do in the first place. Second step is to give them a tailored plan. Like everybody doesn't need IV. Like if I have a patient where I find that the sperm is not going inside or there is cervical factor infertility, I will do natural treatment for that. I can do intrauterine insemination.
Mhm.
But let's say if you're doing IVF, then nowadays in IVF, there is so much cutting edge technology. We can actually genetically select the embryo. We can find out that the embryo is having no chromosomal problems, no Down syndrome. And also we can do gene testing of the parents to select the best embryo and put inside the babies. So for me, I mean, when I'm doing my solutions and the treatment, I get a 80% pregnancy rate with a single embryo transfer, which is a very high pregnancy rate. And we also take care of immune factors because, see, what has happened after the COVID vaccine is that people are having accelerated aging. Women are growing older faster, and there are a lot of immune issues. So I still see, I get, calls from patients in the US who have 4 or 5 failures. And all I find is that they have not done the genetic testing and they have not treated the immune factors, because immune factors nowadays play a very important role in not getting pregnant. I have patients where I have just treated immune factors and they've got pregnant naturally. Oh, wow. And by immune factors, I mean something like, natural killer cells, high immunity. Because of the COVID vaccine, you're rejecting the embryos. So what we do is we do certain lifestyle modifications. We give the patient anti-inflammatory pills, okay, and also high oxidative stress treatment like vitamins, supplements. And then when we are doing the transfer or natural treatment, we are putting certain steroids, certain, hydroxychloroquine. There are medicines to immunomodulate the environment and then they get pregnant. Right?
Okay, great. So my last question, for the aspiring mom who are trying to get pregnant or the parents who are trying to get pregnant, what's the simplest thing or the simplest thing you want to tell to them?
So, I want to advise the generation of now that, see, I mean, do not delay pregnancy. See, I believe in
To the couple, not just
to
for
the
the
couple,
mom.
yes.
Yeah.
So first I want to go to the schools and actually I want to teach the young girls, because young girls, they still don't know about their bodies. Women, are born with fixed number of eggs, and women age.
Okay.
So there is again a lot of myth and misinformation on social media. So I would want to have my channel go global. I want to go to schools and try to educate the girls right from the word go that yes, you are having, like, let me give you an example. See, we go to buy coffee and we have like 10 flavors. So we have choices for coffee. But does the woman of India have choices when it comes to reproduction? Reproductive choices? No. Because first thing, she doesn't know that what is her reproductive span. Everybody doesn't stay fertile till the age of 50 years.
Yeah,
Some
exactly.
women go into premature menopause. And I see so many ladies coming to me at the age of 34, 35, and they have already gone into menopause. And I have to tell them, oh, now you cannot get pregnant with your own egg. So the first step starts with a young girl who is, entering the reproductive age to do a test called as anti-Mullerian hormone, find out about your span, and then take correct decisions. Okay, now let's say if you're a single girl and you don't want to get married, it's perfectly fine. Then you can go for egg freezing. You can freeze your eggs, freeze your
Till
fertility,
the
and
time.
then
Yeah.
yes. Even if, let's say, you have a partner, you can get married and then you don't want to have children. Okay, you come to us, you freeze your embryos, again you freeze your fertility, you can have children after 10 years. See, cryopreservation is so good that embryos can stay as they are for 10 years. Like, Diana Hayden, she's had like 3 beautiful babies
Yeah.
from, the embryos which she had frozen when she was only 30 years old. And she had them when she was 38, 40, and 43. So,
She had 3 children, huh?
yeah. So it's really, I mean, science is amazing, but the problem is people don't know about this. So I want to really create awareness. And of course, the main thing is don't delay pregnancy. See, pregnancy is protected. Pregnancy protects a woman from many diseases. So ideally, we should now go back to our old-fashioned
Yeah,
ways,
exactly.
you know,
The
to get,
traditional way and
yes,
everything.
to get married early and have children, and then maybe go for your career. But if you can't do so for any particular reasons, at least please your fertility. You not like, make yourself suffer, because the higher the age when you're trying to get pregnant, it's really, it's a lot of suffering, lot of struggle. And see, the woman is the person who bears the brunt of it.
Yeah, exactly.
Okay, so I would advise to all the women that please, as soon as you understand and you feel that, you want to get married or whatever, just come to a doctor, get a fertility checkup done. As soon as you come to us, doesn't mean we are going to pick you up and send you for IVF. It's not like that. Okay, so come to us. Even if you're single, still come to us. We will manage you. We will give you reproductive choices. I will tell you that, okay, this is your, reproductive span. And then you can make the most out of it. Right?
Thank you so much, ma'am. That was really very good and very informative. Thank you so much for talking.
Thank you.